Good evening and welcome to Icmr Council's special web series on women's health start supporting treatment in assisted reproductive therapy. I'm Anisha Nair and you're watching our exclusive show on women's health supported by Bharat Serums and Vaccines under its public awareness initiative. This is the third show in our series to mark Infertility Week, where we are bringing in experts to help address some of the issues that could hinder your journey towards parenthood. Now, we are currently seeing the COVID-19 second wave in our country a year after its outbreak. Now, this is a reminder that we cannot put our guards down. We have to ensure masking, washing our hands, and social distancing. This is also a reminder to put our health before anything else. The arrival of the vaccine and the start of the inoculation process, as well as some of the lessons from last year, have brought hope to millions of people who want to stay safe and bring about perhaps a semblance of their pre corona days. But there are many others who find themselves in despair as some of their dreams have suffered a setback because of the many restrictions of the lockdown and the fear of COVID-19. I'm talking about those couples who dream about starting a family but are unable to do so because of infertility. Infertility over the years has emerged as one of the most common health issues that many couples in India have been facing. According to the Indian Society of Assisted Reproduction, infertility currently affects 10 to 14% of the population. The scenario is even worse in cities where one in every six couples is impacted. Our show today is special as we are going to discuss all aspects of fertility and IVF treatment. Bharat Serum and Vaccines Project START is an initiative that aims at providing support to couples beyond medicines with initiatives like microfinancing the treatment and counseling. Project START encourages couples to stay on course of the IVF treatment to achieve their goal of parenthood. Today, we'll be talking about how to select the best clinic for your IVF journey. There may be many questions in your mind on what you should do to succeed in your parenthood journey. On our show, we have an expert joining us to help answer all your queries. Please welcome Dr. Niket H Patel, Medical Director and Endoscopic Surgeon and Fertility Consultant at Akanksha Hospital and Research Institute, Anand, Gujarat. Welcome to the show, Dr. Patel.
Thank you so much, Anisha. And at the inception, I'd like to congratulate Bharat Serum on taking such a wonderful initiative and spreading awareness amongst people, because this cognizance is very much required in today's times. So yes, we can very much start up with the show now.
Yeah, but before we start talking, Dr. Patel, I'd like to remind all our viewers to start sending in their questions. You can just type it in the comment box, and this is your golden chance to get all your questions answered by Dr. Patel. So do grab this opportunity. You have 30 minutes. We'll try to take up as many questions as we can. Do comment and share this page with your friends if you think that they could also benefit from all that discussed during the show. So let's begin, Dr. Patel. Now, a few years back, say just about 10, 15 years back, IVF centers were few and they were largely in bigger metros. So we did see a lot of patients traveling to bigger cities for the treatment. And mostly people picked an IVF center according to the reputation of the doctor there. A good doctor, or the doctor delivered triplets for a celebrity. So you would have a queue of, patients lining up outside the doctor's clinic. So how does one choose which is the best IVF clinic now, given that the number of IVF clinics have increased and now we have full chains of IVF centers, one in perhaps 3-4 cities?
Right. So this is a very pertinent question in today's times, Anisha. So as you're very right that the number of IVF centers have gone up drastically. So in this time, it becomes very difficult for patients to sort of choose which IVF center would they want to choose to go for a treatment. So there are certain points that I'd like to highlight that the patient should keep in their mind. First of all, whichever center they are choosing, see whether the fertility doctors are certified reproductive endocrinologists. So, in India, there exists no course for anyone to become a fertility specialist. It's just a general OBGYN degree. after which one can start practicing fertility. So, at least if someone has gone through that thorough training in India or elsewhere outside India, which gives them that label of being a certified IVF specialist, that is number one. Number two, the center that you're choosing, whether it is a center of excellence, meaning the thing that you said, the reputation that they carry, the success rates, the certifications. The certifications in today's times, by certifications I mean the lab, the embryology lab, is that certified? Is the hospital accredited with accreditations like NABH? Because then you know that there are SOPs which are being followed, and there is systematic working which you can see, and there is things are not haywire. Also, when you choose a clinic, you need to see that how many physicians are a part of the team. The more the doctors the practice tends to have, the better is the service that they are able to provide. Honestly, if the core team is good, they will personalize the treatment, and they will never make the patient feel like a mere number. By this, I know, by no means I mean to say that every time you go in, a patient meets a new doctor. Even that is not right. But the core team of at least 3 to 4 IVF specialists, endocrinologists, whether they are reproductive surgeons, all of that needs to be in place for someone to not be impeded at any stage throughout the course of IVF treatment. Also, by a good core team, what I mean is, IVF requires multimodal treatment. It is not just that your IVF specialist is taking care of it. You might require surgery for something like a PCOS or endometriosis. You might require a male an andrologist if somebody is suffering from male infertility, which is on a rise in these days. Previously, we used to think that only females are responsible for infertility, but now, as we know in the current data, almost 40% of the infertility is attributed to the male counterpart as well. So, if you have all these components or all these specialists in your team under one roof, and the patient doesn't need to go from one place to the other, it makes it all the more easier for the patient. And also what you see is whether your fertility expert is giving you enough time and hearing you out and your problems. Also, when you look at a center, you basically see that what are the latest modalities of treatment they are offering. That is, things might be as simple as a simple IUI, that is injecting sperms inside a woman's womb, to something as complicated as an IVF procedure with PGS, with magnetic filtration of sperms. So are these multifaceted modalities available at that hospital? Apart from that, what is very important is that you need a genetic counselor, because when you're dealing with issues of infertility, when you go to an IVF specialist, or when you, as a patient, you plan to do an IVF, you have to be prepared about slightly higher risk of genetic abnormalities in the babies than a natural pregnancy, right? So is there a genetic counselor in place? Is there a dietitian? Is there a team which can guide you as to what you eat, what you don't eat, what is good for you in these times, how much fibers you should consume, how much carbs you should consume? So all of these things should be in place. Also,
Dr. Patel, I think things have changed. Maybe, patients these days are more aware of, looking out for a multi-team to treat them. Right. Because, for all I know, most people just look at success rates. Right. Clinics claims that they give 100% success rate. Now, it's very misleading, and many people have this unscrupulous practice of saying we have 100% success rates. So how do I protect myself from misleading claims if I'm looking for treatment? And you said accreditation is there, but how do you weed out people who are misleading, innocent people looking for fertility treatments?
So, see, anyone who claims that they have 100% success rate is absolutely false. Whether you are in India, you're in America, in any part of the world, the maximum success rate that IVF centers have seen is 45, at max 50%, even if you use all the modalities like genetic screening and the best possible IVF. Even when you do a surrogacy, the success might go up to 55%, but not more than that. So first of all, whoever is claiming that they have a 100% success rate, that is impossible. Now, how do you verify whether whatever rate someone's claiming is that true or not? See, there are 2 or 3 good surveys happening in India. One is the Times of India survey, which tells you about what is the success rate of that clinic, because they take the entire record. For example, from our unit, they'll be taking the entire record of how many cycles are we doing, how many egg retrievals are we doing, how many embryo transfers we are doing, and then ultimately what success rates we are deriving. So that is number one. Number two, if you are inclined towards joining hands with certain clinics or going to a particular fertility center, you take opinion from patients who've been treated there previously. See, lot many times we've seen that, you know, all these testimonials sometimes tend to be planted as well. But when you hear it from the patient's mouth and, you know, about what treatment they've undergone, and the patient gives you a positive feedback, nothing is more reassuring than that. So that is number two. And number three, once you talk to the fertility specialist there, you know, some 80 to 90% of the times you will realize by the conversation you have that is the person true, transparent, and if any of your relative is living in that area, you can ask about the reputation of that doctor and that clinic carries, which can help you to verify all this information.
All right. Should I consider things like convenience, close to my home, for picking out an IVF clinic, or should I look for good lab facilities, accreditation, strong team? How should I weigh my pros and cons?
So definitely, see, if you're looking for your IVF cycle to be done, the most important part in an IVF cycle is the lab, the cleanliness, the HVAC filters, the amount of contamination that your gametes is going through. So first of all, there should be a class 100 to a class 1000 lab. That is the best lab facility, good infrastructure. I don't think you should give too much importance to the convenience, because say if you're living in some remote area, you might have to go to an urban city for your IVF to be done. Or for example, if you talk about our center, people from urban cities come to our semi-urban area just because we have our infrastructure, lab, and the core team in place. So if you're confident about your core team, about the core team that the hospital has, and if the hospital is well accredited and it carries a reputation, that is more important than convenience and proximity to your place, according to me.
All right, so Dr. Patel, you're saying choose competence over convenience any day.
Exactly.
Because you're going to invest a lot of your time and your money into these fertility cycles. So you better invest in the safest and the most promising bet, right?
Absolutely.
All right. Dr. Patel, we've already started getting a few questions. And we have one Facebook user who's asking us, in COVID times, what are the precautions one should take prior to embryo transfer?
So in COVID times, prior to an embryo transfer, there are a few things that you need to keep in mind. That if you're undergoing an embryo transfer, not necessarily, but you might have undergone an egg retrieval just some time back. So, if you're going for a fresh transfer, at least make sure that the facility that because sometimes what happens is you do an egg retrieval in a different clinic and then they send you for an embryo transfer to a different one, or the stimulation is started at a different hospital and then you go for an egg retrieval and an embryo transfer to a different hospital. So when you're roaming from one hospital to the other, there are certain points of contact where you might be exposed to certain infections. So at least 48 hours before doing an embryo transfer, you should have your RT-PCR or COVID test done, and only if you test negative on that should you be eligible to do an embryo transfer. Number two, if you're feeling any sort of weakness, any minor cough, fever, lethargy, that is not the right time for you to undergo an embryo transfer, because sometimes there is a latent disease or latent infection which is present in your body, which might not necessarily reflect in these RT-PCR COVID tests. And it is only after an incubation period of 3 to 4 or 5 days that this might actually reflect. And nowadays we have so many patients who test negative on RT-PCR and then somehow are positive on HRCT scans. So it is for the patients to decide that only if they are feeling 100% in the prime of their health. Number two, with a negative COVID test. Number three, not having exposure in the past at least 5 to 10 days. then and only then should they consider undergoing an embryo transfer. Because if you're positive and you tend to do an embryo transfer, the results of your cycles are substantially going to decrease.
Right. But you could go through an embryo transfer and still contract COVID. So, what impact does it have on IVF cycles and the success rate of IVF cycles?
So what we've seen is if someone in the recent past, whenever a patient has undergone an embryo transfer, and then immediately if the patient tests positive for COVID, the results of those embryo transfer cycles or the IVF cycles are not great. But we've seen some cases wherein embryo transfer is done. 15 days after that, the patient tests positive, that is pregnancy positive. And then a few days or a few weeks after that, the patient is positive for COVID, that is during pregnancy. So at that point of time, we've also seen that there are increased chances of miscarriage owing to the COVID infection. So that is what we should keep in mind, that once you're pregnant and then if you test positive for COVID, immediately consult your physician. There are certain medications that need to be started. At least the basic vitamin C, zinc, the azithromycin that your doctor will put you on. And your conditions, if they don't worsen, you might, sail through COVID and come out of it. But, more or less, we've seen patients having the outcomes which are other way around, that is ending up in a miscarriage or having some sort of bleeding or some sort of complications which we then have to deal with and ultimately take the pregnancy further.
All right, we have another question, which is IVF covered under health insurance?
I'm very sorry, but the IVF is not covered under health insurance. There are a couple of health insurance companies which are now trying to include IVF, but the problem that is arising in our country is there's too much variations in pricing according to the demographic locations. So, for a fact that the cost of probably an operation of hernia would stay the same or would be 15,000-20,000 up or down if you operate in an urban area vis-a-vis to a good hospital in the rural area. But when you're talking about IVF, the variations are drastic, and that is why the health insurance companies are not able to come to terms with it. Plus also the medications that are required, there are many local as well as international manufacturers of those. And again, the pricing of all these injections is, haywire. I mean, you can find an injection cost as low as 500 to as high as, 15,000. So I guess we should give some time to our health insurance companies. I'm very sure that it will be included in the health insurance sector soon, probably within the next 5 to 6 years.
All right. Dr. Patel, one Facebook user is asking, I've been married for 15 years. I've had 2 failed IVF cycles. I have hydrocele problem and 1 tube is open. Please suggest.
So what I think is she would be meaning is she has hydrosalpinx on one side. That is an inflamed tube or a tube with which is filled with infected water. So if one side she has hydrosalpinx and the other side tube is blocked, she should definitely go for an endoscopy and get the tube on which the hydrosalpinx is there, either the right side or left side, whichever side has that infected fluid should be blocked first, and then she should go for an embryo transfer. Because what happens is when you put an embryo with an hydrosalpinx in situ, the infected fluid tends to wipe that embryo away, and also that fluid tends to be embryo toxic. It does not allow the embryo to be implanted. So you need to block that source of infection going into or seeping into the uterus, and then go ahead with an IVF cycle. I think that is the best ploy for her, and she will see tremendous success rates if she does that.
Dr. Patel, for this patient, if one of her tube is still patent and open, can she try naturally? She can, get ultrasounds done at the beginning of the cycle, and when she knows that she's going to ovulate on the side where the tube is open, she can try naturally.
But you said that the other side had hydrosalpinx, right?
No, she said one tube has a problem, but 1 tube is open.
I understand, but with one tube, number one, the chances of conception again become 50%, and then there is always this looming danger that the hydrosalpinx or the infected fluid might wash the embryo away. So even if she tries naturally, or else what if she wants to try naturally, again the best option for her is to get the hydrosalpinx fluid drained. The tube which is infected, so for example, it is the right tube, and if the right sided tube has hydrosalpinx, get a laparoscopy done, get that fluid drained, see whether the tube is infected, get an antibiotic course to be started, and then after that 1 week of antibiotic course, in the next month she can try naturally if that hydrosalpinx is not that big. Definitely she can do that.
All right, we have another question from a Facebook user saying, with poor egg reserve, would IVF or IUI work?
See, with poor egg reserve, definitely IVF is the only option. When you talk about poor egg reserve, you mean that the AMH or the anti-Mullerian hormone is less than 1.5. And apart from that, the ovaries have started drying up. So once that happens, with poor ovarian reserve, not only does the quantity decrease, but the quality of the gametes or the eggs also reduce. So when the quality is at stake, the best treatment for you is definitely IVF. And sometimes not doing just a simple IVF wouldn't work. You might have to do something like an ovarian rejuvenation with intra-ovarian PRP, that is blood purified and concentrated in platelet form, and then injected into the ovary, rejuvenated, and then do an IVF cycle, which would give you a better result. Depends on what the ovarian reserve is though. But yeah, this is the treatment that is now very common for people with poor ovarian reserve.
IVF is recommended there.
Yeah.
Now we have another question. One user is asking, is it safe to plan pregnancy at the age of 37?
Oh, absolutely. It is safe to plan pregnancy at the age of 37. There are certain things that you need to be wary about. First of all, any pregnancy above the age of 38 or 40 is considered as a high-risk pregnancy. You're still at 37, that's fine. But once you go about 35, the chances of the baby getting genetic malformations like Down syndrome, mental retardation, Edwards syndrome, etc., increases slightly. So you need to make sure that all the checks of the genetic screening are in proper place. You need to get a double marker and an NIPT done at 12 weeks, and routine regular scans done at 3, 5, and 7 and 9 months. And I think you're fine to go ahead and carry a pregnancy.
Right. Another question coming in is, I am 40. My AMH level is low. Should I consider IVF or keep trying naturally?
Oh, your age is 40 with a low AMH level. That is a no-brainer. You should definitely consider doing IVF.
All right. You shouldn't wait. Now, another user's question is, I have low AMH, which is 0.57. Should I do IVF with donor eggs or go with my own eggs?
See, if you've done an IVF cycle previously, then depends on how many cycles you've undergone. Say if you've undergone 3, 4, 5, 6 cycles without any result at multiple centers, then yes, you should try for a donor egg. But if you're planning for the first time and if your AMH is 0.57, you should definitely give yourself a try before enrolling yourself into a donor egg program.
All right. Another question is there any maximum age to receive ART treatment as per the Icmr guidelines?
See, there's no maximum age. To be very honest, we get patients of all categories. But, in terms of age, what is more important is when you're planning with your own eggs, I think the upper limit there would be 40, 42 years of age. Though it is not mentioned anywhere that at this particular age, beyond this particular age, you cannot try with your own eggs. Normally, we usually tend to deny patients whose combined age of husband and wife is more than 100. That is 50 plus 50. Say if someone has reached 50, the female partner and the male partner is also 50. Because then, doing IVF, will they be able to take care of the baby? How many attempts do they require? The body is already compromised when you're pumping them with hormones. So that is a trend that we tend to follow, but nothing in black and white on paper.
Right. Dr. Patel, another question that is coming is, I am 32 years old. I weigh 110 kgs. I was 120 last year. I've been trying since 2 years now. Can I directly go for IVF? I'm on metformin and
Inositol.
inositol for a year now. So she's made some progress in her weight loss. Do you think she's ready? Should she go for IVF? What should she do?
So 32 years, 110 kgs, with the medications that you mentioned, mannitol and metformin, seems like it's a case of PCOS. You should definitely consider doing IVF. You've lost 10 kgs. Congratulations on that. It might also be because of the metformin, because it sucks off some of your weight. But yeah, in PCOS, the quality of the eggs usually tends to deteriorate faster than normal females. So post the age of 30, 32, PCOS females find it increasingly difficult to conceive even by IVF. So you should definitely plan on doing an IVF as soon as possible, and get it done at a good center with proper precautions, because you will be at a risk of OHSS, that is hyperstimulation syndrome. So get it done at a good center by a good reputed doctor, and I guess you will have a good result with IVF.
Why is the risk for OHSS higher?
Because she has multiple follicles developing. So as you said that she has metformin and myoinositols, which she's taking, and PCOS females take that because there are numerous small multicystic follicles which cause hormonal imbalance, that is change in the glucose levels and etc. But when you do an IVF, all these small follicles will tend to enlarge, and then they will sort of exude fluid, and there will be this third space fluid loss. And as a result of which, what happens is females will come to you with vomiting, with increased abdominal girth due to ascites, and that sometimes might be life-threatening. So in PCOS females, while stimulation or doing an egg retrieval, one should be very careful about the estradiol levels, which give you a hint on ovarian hyperstimulation syndrome. And that is why an experienced reproductive specialist or an endocrinologist is required here, because they will calibrate the hormones in such a way and give those injections or those medications which will prevent this female from going into ovarian hyperstimulation syndrome.
Right. Another question is, I'm 32 years old. My husband is suffering from low count and slow motility. Is this the right time to take a call for IVF, or do you think they could benefit from IUI as well?
To answer your question, low count as to how low it is. If it is in the range of 10 to 20 million, and if the motility, grade 1 and grade 2 motility is slightly compromised, then there are always multivitamins and antioxidants which are available in the market, which can improve or give a boost to the mitochondria in the sperm. And also a healthy lifestyle. So if there's any sort of substance abuse, you avoid that. Get a healthy lifestyle in place for the next 3 months, and then re-verify your semen analysis. If it's out to be normal, you can continue trying naturally. But if the lifestyle isn't that healthy, if the semen count is compromised, highly compromised, then definitely you fall into a category of male factor infertility, and you should be considering IVF as soon as possible.
All right, we'll take our last question. And this user is saying, my age is 39 years, my AMH is low. Is there a possibility of natural conception, or should I go in for advanced treatment?
39 years of age with low AMH, natural conception would be miraculous. So definitely you should consider some
Not waste time.
Yeah, this is the perfect time to start an IVF, but at least take a step and start going to the fertility clinic, and let your doctor at least examine you as to what your current status is or the status quo is, and then take a call. But definitely you should be looking for some sort of treatment.
All right. Thank you so much, Dr. Patel, for joining us on the show today and answering so many questions from our viewers on their specific fertility problems, as well as helping everybody understand how to make a choice of the right IVF center for them as well. Thank you so much for joining us.
You're most welcome, Anisha. It was my pleasure.
Thank you for being with us. So that was Dr. Patel answering all your questions on fertility and IVF treatment during COVID-19. If you have more questions, you can send them to us. Use our WhatsApp button, just click on it. We will try to take up more of your questions in the subsequent shows. Don't forget to follow us and to stay updated on all that concerns your health and well-being. This program was supported by Bharat Serums and Vaccines under its Public Awareness Initiative. We'll be back with our special shows on women's health. And do keep a track of our Facebook page. You'll come to know when our next episode is due in our special Infertility Week series. Do follow us on Facebook. Keep sending us your questions and we'll certainly try to include them in our subsequent shows. Till then, stay at home, stay safe, take care. Goodbye.